And people with paranoid schizophrenia always experience hallucination, delusions, and disorganized thinking and speech. The hallucinations, for example, people maybe can hearing the voices and not really exist. And now let's analyze the reasons for this disorder. Researchers today still do not know what specifically causes this disorder. However, most professionals agree in the biopsychosocial models. That is, the causes are more likely due to the biological and the genetic factors, social factors, and psychological factors. For the social factors, such as how a person interacts in his or her early development with family members and friends. And for the psychological factors, for example, such as personalities and temperament, which are also shaped by the environment and the abilities to deal with stress. And this model suggests that no single factor is responsible, but it's the complex and reciprocal nature of these three factors are important. And also the early childhood experience, including physical and emotional trauma, also plays a role in the development of PPD. And this disorder appears to be more common in men and the people who have the close relatives with the paranoid schizophrenia. And as the definition and causes have been given, now we can try to figure out some possible treatments. Treating with the people who have paranoid personality disorder sometimes can be very, very difficult because people with this disorder are often very suspicious with doctors. However, the psychotherapy and the specific medication sometimes still can be effective when an individual is receptive to intervention. First, let's look at the psychotherapy. A therapy which emphasizes a simple, supportive, and client-centered approach will be very effective. The therapist must focus on the client's current life difficulties and not inquire too deeply into the client's history and life. And as the therapy progresses, the client will be likely to begin trust on the doctor and be willing to tell more things about themselves. And also the therapist must be careful balance being objective in therapy and arising the unnecessary suspicions. And second, sometimes the medications are not so appropriate because using medications can arise the suspicions and the treatment drop out. But for specific condition and a brief time period, the medications can be helpful bring the conditions under management. For example, antipsychotic medication is appropriate if the patient begins delusional thinking, which may result in self-harm and harm to others. And the self-help support group, which is commonly used by social workers, however, is not effective to treat with this disorder. So, because people, again, with this disorder, always insufficient and mistrustful of others, that makes the group help impossible and even sometimes harmful to them. And the prognosis is given by the studies. This disorder occurs in about 0.5% to 2.5% in the general population, and it is seen in 2% to 10% of the psychiatric outpatients. And in one word, PPT is a subtype of personality disorder, which is characterized by the mistrust and suspiciousness. And although the specific reasons for this disorder haven't been realized. The combination of biological, social, and psychological factors are very important. And there are challenges in treating with this disorder, but the psychotherapy and medication still can be effective. I think I have shared the things I want to tell, and I'm happy to answer your questions.
Okay.
Thanks for the presentation, and I'm just curious about you're talking about the causes and treatment. They match or just like the client central therapies focus on their social causes and the medications for the biological causes or not?
Okay. Thank you for your question. I think maybe there are kinds of combination. Like for the client-centered approach, should focus on the social factors and the psychological factors together. And the medications may be just suitable for some very serious condition.
So you just mentioned that the social causes might include the family members or the relationship between family members?
The relationship, yes,
The
and how the person interacts with their family members and friends.
So do you think the family therapy is more like effective?
Though I haven't found the specific data, but I think sometimes we cannot just use only one approach. Maybe we can use one or two together. So maybe we can maybe we can use the client-centered approach with the client, but also work with his family, use the family therapy together. Maybe will be better.
I have a question. Would you mind telling me if they can live independently?
I think it's depend on their condition, the level of this disorder, because it's better than the paranoid schizophrenia. Those people maybe needed help from others, but people with this personality disorder, if they are not so terrible, they can be independent.
So it is better to live with family or put them into the hospital?
I'm sorry, I haven't searched this, but I will find this later and tell you.